Marin General Hospital has been looking for a way to improve communications amongst members of the care team, but also to make sure that all of the elements of an evidence-based discharge get completed in a timely fashion. Carebook has provided an elegant solution to this. It not only allows the caregivers to see a checklist that is evidence-based and puts that information in front of the caregivers in real time, but it also allows them to communicate and to collaborate in real time around the elements of the checklist.
Hi, I'm a nurse on the medical unit at Marin General Hospital, and Carebook has been very beneficial to me as a nurse. We have a lot of very complicated patients, and when it comes to their discharge, there's a lot of pieces that need to fall in place to have a safe discharge. Carebook enabled us to put together a safe discharge. We were able to see what all the rest of the disciplines that were involved in the discharge had accomplished and what we still needed to do before our patients were discharged.
I'm one of the hospital's physicians, and I participated in the Carebook trial, and one thing I found really helpful was the ability to communicate with the whole care team simultaneously. One of the examples is if we had a patient that had a new diagnosis of diabetes and needed to be on insulin, we could initiate the training and the follow-up from day one. And it was easy to communicate with everybody without having to page separate people or having to return pages. So I found that to be very helpful.
Okay. Hi, I'm Sharon. I'm one of the RN case managers here at Marin General. And what I like about the Carebook is that we are able to communicate with all disciplines in order to facilitate a safe discharge. We're able to use it to immediately contact all the parties involved with how to plan for discharge, including nursing, case managers, doctors, pharmacy, wound care, diabetes, all the disciplines needed to enable that patient to leave the hospital with the best outcome and for the least amount of returns.
One of the other things that I really liked about Carebook is the immediate response that we could get as nurses when we needed to report a condition to the MD. We didn't have to page them and wait for them to return our call. They could just immediately respond to our requests or our concerns.
Today, with Carebook, Care in Sync is helping make patient care transitions safer. In a hyper-connected healthcare future, HIE networks will connect patient medical records across providers, and Carebook will enable multimodal collaboration across patient-centric communities. This is our vision.